HHA Practice Test 2026 Home Health Aide, Full Course Oral Hygiene Teeth and Dentures. Question 1. How should an HHA position an unconscious client for oral care? On their back, supine. On their side, lateral, with the head turned to the side. Propped up on 3 pillows. Sitting in a chair. Lateral positioning prevents aspiration, choking on fluids. Question 2. What is the primary goal of oral hygiene? To make the teeth look white. To remove plaque and prevent infection/decay. To help the client taste food better. To save money on dentist visits. Hygiene removes harmful bacteria and maintains the health of the mouth. Question 3. How should dentures be stored when not in the client's mouth? Wrapped in a paper towel. In a labeled denture cup with cool water. On the bedside table. In the client's pocket. Water prevents dentures from drying out and warping, labeling prevents loss. Question 4. When cleaning dentures, what should the HHA do to prevent them from breaking if dropped? Hold them with a tight grip. Line the sink with a towel or fill it with water. Wear thick rubber gloves. Only clean them over the bed. The towel or water provides a cushion if the dentures slip. Question 5. How often should oral care be provided for a conscious client? Once a week. At least twice a day, morning and evening. Only when they eat sugar. Every hour. Twice daily care is the standard for oral health. Question 6. Which of the following is used to clean the mouth of an unconscious client? A hard bristle toothbrush. Sponge swabs, toothets, and a small amount of water/rinse. Floss. A water pick. Swabs are gentler and use less fluid, reducing aspiration risk. Question 7. What should an HHA check for during oral care? Loose teeth, sores, or bleeding gums. The client's favorite toothpaste flavor. The brand of the toothbrush. How many teeth the client has. Observing the condition of the mouth is a key clinical responsibility. Question 8. When brushing a client's teeth, at what angle should the brush be held against the gum line? 90 degrees. 45 degrees. 10 degrees. 180 degrees. A 45-degree angle effectively cleans the sulcus, area between tooth and gum. Question 9. Why shouldn't you use hot water to clean dentures? It makes them smell bad. It can warp the plastic. It hurts the HHA's hands. It kills the good bacteria. Heat can permanently damage the shape of the dentures. Question 10. What should the HHA do before putting dentures back in the client's mouth? Rinse them with cold water. Dry them with a towel. Apply super glue. Ask the client to gargle with salt water. Rinsing removes any loose debris or cleaning solution and makes them easier to insert. Question 11. If a client's gums are bleeding during brushing, the HHA should scrub harder to remove the blood. Stop and report it to the supervisor. Tell the client to stop eating candy. Ignore it as it is normal. Bleeding gums can indicate gingivitis or other medical issues. Question 12. What is halitosis? A type of gum disease. Bad breath. A tooth cavity. Inflammation of the tongue. Halitosis is the clinical term for persistent bad breath. Question 13. A client wants to clean their own teeth but is very slow. The HHA should do it for them to save time. Encourage and assist them to do as much as they can. Tell them to hurry up. Skip oral care that day. Promoting independence is a core goal of home health care. Question 14. How should the HHA clean the tongue? With a sharp scraper. By gently brushing from back to front. With a paper towel. The tongue does not need cleaning. Gentle brushing removes bacteria and improves breath. Question 15. What should an HHA use to moisten the lips of an unconscious client? Water-soluble lubricant or lip balm. Vaseline, petroleum jelly. Butter. Alcohol. Water-soluble products are safer and more effective for dry mucous membranes. Question 16. How often should oral care be provided for a client who is NPO, nothing by mouth? Never. Once a day. Every 2 hours. Only when they ask. NPO clients are at high risk for dry mouth and infection, frequent care is needed. Question 17. Where are dentures usually placed after being cleaned at night? In a dry cup. In a cup of mouthwash. In a cup of cool water. Under the client's pillow. Cool water is standard for overnight storage. Question 18. When flossing a client's teeth, the HHA should snap the floss quickly between teeth. Gently move the floss in a C shape around each tooth. Only floss the front teeth. Use the same piece of floss for all clients. Proper technique prevents gum injury and ensures effective cleaning. Question 19. If a client has a coated tongue, it may be a sign of dehydration or poor hygiene. Eating too much fruit. A high-protein diet. Sleeping with the mouth closed. A white or yellowish coating often indicates bacteria or yeast buildup. Question 20. When removing dentures, which one is usually removed first? The bottom denture. The top denture. It doesn't matter. Both at the same time. Removing the upper denture first often makes the process easier.